The biggest single area on the NCLEX-RN is not medicine at all. It is management of care, and this is how it works. Management of care is 15 to 21% of your exam. That is the heaviest area in the whole test plan, and it is not pharmacology or cardiac care. It is deciding who does what and who you go to first. It really comes down to two skills: delegation, which is who does what, and prioritization, which is who you see first. Let us take them one at a time, starting from 0. Delegation first. Every question is asking whether a task can be handed to someone else, and if so, to whom. And there is one rule underneath all of them. Here it is: you can delegate the doing. You can never delegate the deciding. A nursing assistant can take a blood pressure. That is doing. Deciding what that blood pressure means and what happens next is nursing judgment. That never leaves you. Which gives you 4 things that can never be delegated: assessment, teaching, evaluation, and any client who is unstable. If a question hands one of those to someone else, that is your answer, and it is wrong. So what can each person actually do? Unlicensed assistive personnel handle stable and predictable work. Vital signs on a stable client: bathing, feeding, positioning, intake, and output. A licensed practical nurse can go further on stable clients. Dressing changes, sterile procedures like catheter insertion, and most medications. And you, the registered nurse, keep assessment, teaching, evaluation, and anyone who is unstable. Let us work 1. A charge nurse is assigning tasks. Which one is appropriate to give to a nursing assistant? Assessing lung sounds on a newly admitted client. Reinforcing teaching about a low-sodium diet. Evaluating a client's response to a new pain medication. Or measuring vital signs on a stable client scheduled for discharge. Run the rule. Assessing lung sounds is assessment, so no. Teaching is teaching, so no. Evaluating a response is evaluation, so no. Vital signs on a stable client is pure doing on someone stable. That is the answer. Notice you did not need to know anything about lungs or sodium. You needed the rule. One more, because this one is phrased backwards. Which delegation requires the nurse to intervene? In other words, which one is wrong? A nursing assistant helping a stable client with morning hygiene. A practical nurse inserting a urinary catheter. A nursing assistant teaching a client to use an incentive spirometer. Or a practical nurse giving an oral blood pressure medication. Hygiene is fine. A sterile catheter is within a practical nurse's scope. Oral medication is fine. But a nursing assistant teaching anything is teaching, and teaching never gets delegated. That is the one you stop. Watch for that phrasing, because requires intervention means find the mistake. Now the second half. Prioritization. Who do you go to first? Run these in order and stop at the first one that answers it. Airway, breathing, circulation. Then unstable before stable. Then actual problems before potential ones. Then physical needs before emotional ones. Try one yourself. You get report on 4 clients. One is anxious about going home today. One has new stridor and is working harder to breathe. One has a chronic pressure injury waiting on a dressing change. One reports 6 out of 10 pain after abdominal surgery. Pause here if you want to decide first. It is the stridor. Stridor is a narrowing airway, and airway is the very first filter. Everything else is real, but none of it is going to stop this person breathing in the next few minutes. Anxiety is emotional. A chronic wound is chronic. Expected pain after surgery is expected. And that is the pattern. The hardest priority questions give you 4 things that all genuinely need attention. Only one of them threatens an airway, or a breath, or a circulation. So to recap, management of care is the heaviest area on the exam. Delegate the doing, never the deciding. Assessment, teaching, evaluation, and unstable clients stay with you. And for priority, airway, breathing, circulation, then unstable before stable, then actual before potential. Practice these with real NCLEX-style questions. Free at .com/en/NCLEX.